We're closer than ever to the coronavirus vaccine. I'm Adrienne Pedersen, today on Upfront. State health experts plan for the vaccine's deployment, but Republican state lawmakers want a say. I'll talk to a top Republican. That's next on Upfront. Plus,
everything that's been put out shows that these vaccines are safe and something that we would highly encourage everyone have.
What you need to know about the new COVID vaccines. And supporters of President Trump make their most brazen play yet. What happens when presidential electors meet tomorrow?
Taking on the issues important to Wisconsin. This is Upfront with your host, Adrienne Pedersen.
This is one of the greatest scientific accomplishments in history. It will save millions of lives and soon end the pandemic once and for all.
The COVID-19 vaccine is moving fast now that the FDA has approved Pfizer's shot. But that approval was not without controversy. Several national news outlets reported the White House told the FDA chief to approve the vaccine Friday or resign. Healthcare facilities in Wisconsin are getting ready. Milwaukee's VA Medical Center will be one of 37 VAs to receive the first doses. The VA installed a dry ice storage unit to keep the Pfizer vaccine at -94 degrees Fahrenheit. Some people are eager to get the COVID vaccine, while others are skeptical. Dr. Fauci says 75 to 80% of the population needs to get the vaccine so we can all return to normal. We're talking now with Dr. Aaron Morecambe, a Mayo Clinic family medicine physician in La Crosse. So, doctor, I appreciate your time. I know you said you're on hospital service right now. You're busy. Tell me what it's like there.
Yeah, so we've, over the last few weeks, had a bit of a surge in our COVID cases here in our hospital. Fortunately, we're seeing a little bit of a downtrend right now, but that doesn't mean with holiday gatherings and Thanksgiving recently and upcoming Christmas that there couldn't be some more uptick in cases. So we're really excited that this vaccine is coming about, hopefully in the very near future.
And when it comes to the vaccine, when do you think that you and your fellow employees will have access to it?
We have been working on committees here to make sure that we're ready for it when it comes, and hopefully in the next few weeks, we will get our first supplies of it.
How do you prepare for that?
So we have a team that is prepared for it. We've got nursing staff on it. We've got physicians that are ready. Really, we are trying to make sure that we have all of our facilities and everything set up ahead of time so that we're ready to go once it does come.
And as far as you know, will Mayo Clinic mandate vaccines for employees?
So right now it is an opt-in process. So we are not mandating that employees have it, but we are very strongly and highly encouraging that all employees be vaccinated to protect both themselves as well as our patients.
And so you're strongly encouraging that there. But as you know, there are skeptics. I mean, there are people who are hesitant to getting the vaccine saying, you know, I'll let everyone else go first. I'll see how they do. And then maybe I'll consider getting the vaccine. What are you telling your patients? What would you tell your patients if they use that reasoning?
Right. And I think it's understandable that there are some people that are skeptical about the vaccine out there. What I will say is any vaccine that gets approved has had extensive safety measures that have been done and will continue to be done after the vaccine is approved, that all public health officials, anyone working in the healthcare realm has high confidence that these vaccines are something we really need to have to help to lessen the burden of the pandemic. Everything that's been put out shows that these vaccines are, for the most part, very safe and something that we would highly encourage everyone have.
You work in family medicine. You're getting a lot of questions about the vaccine. What are people most interested in learning?
We've had a lot of people that are actually very excited for when this will come out. When can I get my vaccine, which we're really encouraged by. I think a lot of people are a bit hesitant about how fast it's come out, but the nature of the vaccine and it being an mRNA vaccine, which is one that can be manufactured a bit quicker than some of our traditional vaccines, is one reason why we're able to make it so quickly and why we're really recommending that people have it, because it's not made with any sort of live virus or anything like that. There are no virus particles where you could get COVID-19 from it. That's been a big question from people. Also, just whether or not they're going to have any sort of side effects from it. Side effects it is a 2-dose series, and so you can have side effects after both the first and the second dose. They tend to be very mild: fever, headaches, body aches. It's not an indication that you have contracted COVID-19 virus, as it's not possible to get it from the vaccine since it doesn't have live virus. It's actually a very good sign that your immunity and your immune system are being built well from the vaccine.
I know that's a question people have asked, and that's a concern, so I'm glad you cleared that up. We are hearing about those allergic reactions in the UK, and I know that doctors have now said they're not recommending people with those severe type of allergic reactions to the vaccine to get it just yet. But are there other people who you think maybe should hold off?
So there have not been studies in young children, and I don't think pregnant patients were included in those studies as well. So those are going to be groups that we're recommending maybe aren't the first people to be vaccinated. We're really going to be prioritizing that these go to healthcare individuals that have high contact with COVID-19 patients, as well as adults with comorbidities such as diabetes, hypertension, hyperlipidemia, really cardiovascular risk factors, and then patients in long-term care facilities and the elderly. We're anticipating that as the year goes on into 2021, into the summer, and for sure, hopefully by the end of 2021, there will be enough vaccine to roll out to other individuals, but likely towards the end of that spectrum will be those ones that have not been studied. Even though those patients have not been studied, it does appear that since this is not a live virus vaccine, it likely would be safe. So if it's a really high-risk pregnant patient, potentially they could be considered, but maybe not rolling it out to them right away, especially if they're not in that high-risk category.
Okay, doctor, we appreciate your expertise, and thank you so much for all the work you're doing.
Yeah, thanks for having me on.
Coming up, Republican state lawmakers say they want oversight of vaccine distribution here in Wisconsin. So we'll ask exactly what they mean by that. That's coming up next on Up Front. Plus, what happens when presidential electors meet tomorrow?